To Community Heartbeat, presented by Outreach Community Health Centers. Not just a show. This is a movement dedicated to bringing our community together through wellness, keeping your heart pumping with positivity. I'm Ebony Ssali. Happy Friday to you. How y'all feeling? That's my question I'm always going to ask. How you feeling today?
Let me get out the way. Can I get in? Can I get in and get
First,
out?
Devo, how are you feeling today on this beautiful Friday morning?
I'm blessed and highly favored.
Outstanding.
Just wanted to say to you, it was certainly great to see you
Listen,
the other day at the holiday wellness
the family
broadcast.
came out, right? The
Man,
family came out. That was a good time.
all your cousins I hadn't seen and you hadn't seen. It was like a family reunion for
It
you.
really
for
was.
You, wasn't it?
It really was. Listen, from the time I got there, a couple minutes after 7, just a couple moments.
Yeah,
after
that wouldn't be
7,
Ebony
just
Ssali if
it
wasn't
wouldn't.
a
It
little
wouldn't.
after,
Just a tinge. Let the other people in first. I'm very gracious that way. But it was a family reunion. So shout out to NOV for just producing a great event. It was phenomenal. All my cousins were in the building, so I was so glad to see.
So y'all don't even have to have a reunion this year. Y'all done did y'all.
No, we got to because we didn't have a grill. We didn't have anybody on the side.
Is that
I couldn't take a walk with my cousins.
You got to have
all that
grill.
kind of, all those.
So what was it like? Just asking you quickly.
Yeah.
What was it like in the vendors room where
Listen,
all of
first
the
off,
presenters were?
Let me say, the Deltas were out there cutting up, okay, from the time I got there. So in the vendor room, were the AKAs, my sorority sisters. So greetings. We were in there just chatting, but it was a good time. So D9 showed up and showed out.
That's good to hear.
It was a very, very good time. Got a chance to make some new connections, so that was a good thing.
That's a part of it. That's a part of why you do these events. The elbow rubbing and the networking and getting to know the movers and the shakers behind some of these other organizations that you might be able to utilize in what it is that you do down at Outreach.
Yeah,
you know?
And it's knowing that we're all trying to build the same community. So that was good for me, right? It was very, very good.
Thank you.
Cheek still hurt a little bit from smiling.
I know you want to get over there to Scoop News. So,
no, it was good. That's on my list. That's on my rundown.
Oh, okay. Sure. I didn't know because Scoop allowed to take you anywhere.
Oh, we're gonna talk about the fan club that came out. The Ride Out fan club is real.
Well, they call him Streetcar.
Yeah, well,
he got some aliases.
Well, listen, and they love some Ride Out. See,
did you hear the ovation they gave him?
They call it already. You know why? Because Ride Out is what moves NOV. Okay, you hear me?
Lord.
Just saying. But I got to see some friends, some listeners. Y'all all right? Y'all all right with me? So it was good to see y'all. I owe a couple people a couple gift bags because they rolled up on me and were mad they wouldn't be able to stay to the giveaway. But I hear there was giveaways. Y'all was making it rain.
Of course, this is what we do. Mm-hmm. I didn't agree with them giving away the wine while the preachers was up.
Oh, there was wine and nobody thought to come and get me out of the vendor room.
Well, no, we weren't serving it. You could win it.
Right, to have at home to kick off your weekend.
For later in the day. Please do not open this inside. Thrive on King. Do not open the wine up in here.
A picnic basket. We have a caller this morning. Greetings and good morning. Welcome to Community Heartbeat.
Good morning.
Well, greetings and good morning, my Angela. Good. It was so good to see you.
Yes, it was so great to see you too, Ebony. It was so good. So, but getting back to that person, I said, good morning to you, sir. But I am Ride Out #1 fan.
Listen
for everybody
here.
in Milwaukee to know I got that. So y'all can just fall back.
Got that.
Thank you.
She said what she said. Ride Out. Listen, your fan club was definitely in the building. That I can say.
I got that.
Now, Angela, one could ask, what does I got that mean? But I feel like the girl code.
Please don't.
The girl code. Listen, the girl code will never tell.
Please do not.
We'll never tell.
That's just saying we're real good friends. He's just a very nice gentleman, and he deserves honor. Every time I call in, I gotta speak on Ride Out, and whoever be talking crazy to him, I gotta put him in check.
I appreciate you, security.
Listen,
I gotta put him in check.
Angela, you don't have to thug out every time, baby.
Listen, but you have to let him know. You have to let them know. The possibility of the thug out is there.
Right.
Okay?
We'll see, Angela. Angela, can I say this to you?
Sure, you
take me back to 94.
I gotta wait till Street Newsworthy and Ebony get through it. I was very disappointed.
Why were you disappointed?
Ebony, the day prior to the wellness broadcast, Angela called in and stated that she would be picking Jermaine up on her new scooter. And they were going to ride down Atkinson and then come around 3rd Street.
Into the sunset?
No, they was coming to the broadcast. They was coming to the broadcast on her new scooter.
Oh, I like that.
So I suggested to them, I said, why don't you, instead of doing that, because it's been cold the last few days, just ride him over there to the bus stop right there, bus street. Y'all hang the little scooter on the front of the bus, and y'all get on and ride in style down there on the MCTS, you know.
You know
and
you know what? Look,
I looked up and I saw Angela and Jermaine. I expected to see Jermaine there, and I wanted to see the new scooter. She did something different.
For the reason why the scooter wasn't in existence, because I don't have a ramp attached to my home yet. So that's why I can't get it out.
So you got to throw it out the window. You got to throw it out the window and then jump.
You know what?
You can't be doing that. And it ain't going to be working.
If Rideout just go over there and pick it up like a gentleman.
And bring it on down.
And just like a gentleman.
Well, that's really the purpose. You're supposed to pick him up.
Come get me. How am I going over there and bring it down and then come back to the station?
Ebony, just do the visual on that.
I guess he got to stay.
Sitting in Angela's lap riding down Atkinson.
Listen. You gotta be full court press with that love thing. You gotta be full court press with that love thing. I love
You got the helmet and I got the helmet.
You know what?
we both gonna look like Martians riding down Atkinson.
I actually love that. I actually love that. I would like to see that. If you want to support the Ride Out Scooter Fund, 414.
Hey, safety first.
Safety
first.
The helmet's going all of 7 miles an hour going back. I love it. Listen, go get your people is what I'm saying. If you're in love, go get your people. We talked about this last show. It's cupcake season. Do what you got to do. Match your helmets with that is cute.
Make it like the Great Kazoo right down Atkinson.
Yes,
I'm
man.
just calling in to say good morning to you all. Good morning, Ebony. Good morning, Devo.
Good morning.
Clark Kent, who you with? Good morning, Ride Out.
Good morning.
Listen, you got us in here cackling and cracking up.
It's about that time that we get that breakfast in before.
Well, you know what? There's a guy out here with a skillet and some bologna sandwiches. So, man, I'm gonna have him fry us up some bologna. And we're gonna have breakfast.
Wait a minute now.
Y'all ain't got no problem with
that's fried bologna is the move, man.
Yeah,
it actually is though.
Oh well, fried spam though. I'm gonna have them.
I love a good bologna sandwich. Let us not ever get so.
Y'all gotta look at it like this. I don't eat meat, so
that's fair.
Well, what do you eat?
I tell you what, I'm gonna have them cook you up
plant-based everything.
A whole pot of nothing. It's gonna be steaming.
Pot of nothing.
It's gonna be seasoned. And hey,
just
there
a
you
pot
have
of
it.
nothing.
This is a pot of nothing.
It's a pot of nothing. Y'all
right, well, I'll roll with that since it's you.
Look, that feels like that's going in a different direction. This is a family show.
As long as she can spend that quality time with you, she don't care
We
for
ain't
somebody.
doing all that. Now, y'all calm y'all nerves.
Listen.
Okay, she said, cool it. We doing the most.
Right, y'all doing too much now. Me and Ryan, we just seriously, Milwaukee, this is just a real good friend of mine.
I love
and this is a family show, so we don't get down like that. We're just good friends.
That's
I like
right.
that.
I'm good friends with Devo. I'm good friends with Ebony, Michelle, Clark Kent.
I like
But that's my security right there, man. That's my security. You understand me? Security.
I love it. Well, Angela, you have a fantastic weekend.
All right,
It was
you all have a
always
good
good to see you.
weekend too, and it was such a fabulous day that I got to see you all and blessed and
Yeah.
to you all.
Yes, right back
All
at you. We
righty.
love you. Listen, again, it was a good time. So NOV again, kudos for a great event. Great.
This dude.
So much good information. The resources. I love to see. I will say this. I love to see when the mayor comes out, when the sheriff comes out, the police chief comes out. I love to see that. Not show of force. That's not the word I want to use, but that presence, the power of that presence. Milwaukee has challenges, but to see who gets to step up and who has the passion behind
it really looked like a unified front that day.
Right.
You looked at the highest ranking positions in the city, from a law enforcement standpoint as well as city government.
Yeah.
And to have all of those dark pigmented skin folks that look like me sitting up there.
Moisturized.
That was a good look. It was a good feel. One, to be able to bring all of that together under one roof, to see that happen. And then, three of the most prominent young pastors in the city were there as well.
Also,
when you look at that, and of course, the last panel that we did was one that needed to happen just the same when you start talking mental health and grieving and healing. So having those three mothers there that had endured, the loss of a child, that's traumatic within itself. But then how they lost them, was key. And for them to be able to speak to, and I hope that, and then we believe that somebody that was going through the same thing, that is going through the same thing, took something from that.
Yeah, we'll find that comfort and find that network. I think when I left, the sentiment I left with, was we are together.
Mm-hmm.
Like we are together. So we will either rise together or we will fall together, but we are together. So I hope that the idea is that one we rise together.
That the chief of police stated, and it wasn't no revelation, but the fact that he said it and he stood on it. And when he spoke about when his home was burglarized as chief of police, his daughter was there, and this, that, and the other. It is not just his job or the police's job. It's all of our job. To police this community.
Yep.
So it was powerful for me that day.
That's it. What you feeling like? And you know what? I'm sad because Rideout wasn't present. So we're gonna have to figure out a rotation schedule
there, though,
or some because your people did come out and they were
there.
looking for you.
Yeah,
that was the one that was trying to fight at the front door. Them was his cousins.
Yeah, my little Bobo and them, they always tearing up something. But
little Bobo now.
As I was sitting here watching it on all of these screens that's in front
Y'all
of me.
not gonna have Rideout always sitting out. It's not fair.
I know that it was powerful in the room. Now, of course, I would never know how it felt to be in the room because I was back here.
We gonna make sure next time. Next time, listen, I'm taking attendance next time, so I got you. I got you.
No, but all serious note,
that
it seems like it was something that the community needed.
Indeed.
Just the whole thing of people engaging with one another.
Because it's been a long. Listen, it's only been technically 10 months have elapsed, but right. So just to have that community togetherness was like we going through it for
good
real.
Energy,
we going through it.
So now I really understand the whole thing of assembly, because you just never know by coming together the energy and all of the good things that happens when you come
gather.
Together,
when you gather, listen, it was like a church service. I saw some of the pictures. Shout out to Terrence Sims. Shout out to Terrence Sims for taking photos. So make sure you check your socials and see what that looks like. A mess is all I can say. Is a mess, y'all. We need 360 cameras in here so y'all can see what I share and what I get with and all that good stuff. So it's always a good time. It's always a good time. I will also say this. Let us make more intentionality around gathering. Let us take more intentionality around taking care of each other. And again, I shared this last show. As we start to think about food insecurity, as we start thinking about people losing their benefits, as we start thinking about all these things, fall back, take a moment, and see how you can step in the gap and help somebody else. Please do that. Take a moment to do that so that we all build together. So again, great event. I love y'all. Okay. I really, really do. Other things that are happening. Open enrollment. So in the second hour of the show, we'll talk open enrollment. We'll talk benefits. We'll talk about what is happening as the world is on fire just a little bit. How we stay safe, how we stay healthy. I'm gonna get on y'all about vaccinations. So y'all already know I'm gonna get on Ride Out about his vaccinations just to keep us all healthy. I will say this though, someone came up to me at the health fair and they shared with me some information that I thought was interesting at the health fair. Vaccinations are not for everybody, and I can respect that, right? So let me step back and take a real conversation moment. I know that not everyone can have vaccination. I get it. There's other health challenges that might come into play, but if you don't have any health challenges that would keep you from having a vaccination, let me say this is a time for us to really take care of each other. I was out on vacation this week, took a little time to myself, and got caught in the travel fiasco, all of that. But on the plane, coming back to Milwaukee, once my flight actually did board, I had 2 people on the left of me coughing and sneezing. I had 2 more people on the right of me coughing and sneezing. And I was there with my mask on, my N95 mask. And I got a few dirty looks from people like, ugh, is she wearing a mask? But I thought about this. This person is coughing and sneezing on both sides of me for 2 hours. And you think you won't get sick? Of course you will. So this is just really a numbers game, right? Now, if I get sick, I go to work and I sit in a board meeting. And I sit in a board meeting with 12 people. And now I'm coughing and sneezing and on those 12 people. Now they go back to their houses and they are coughing and sneezing on folks. So I get it. Vaccinations are not the coolest thing ever. I get it that it's not the most fun to travel with the mask on, but I will say this. I have too much going on in my life to be down for 2 weeks, and I believe that you might have a lot going on in your life. So you probably can't be down for 2 weeks. So if you can, this is your clarion call from your sister, homegirl, friend, big sister, little sister. Get your vaccinations. And of course, Outreach Community Health Centers has those vaccinations for you from 9 to 4, Monday through Friday. Walk in, get your vaccination. So let me step off my soapbox now. That's my public service announcement. It really will take all of us together to keep healthy and to keep well. Harm reduction. Let me also get this plug in. Because things are changing, because life is more challenging, the way people are responding to those challenges remains, I won't say, let me see, what's the word I'm looking for? Life is hard. Some people do turn to substances for those challenges. If you or someone you know is having difficulty with that, have them come on in to Outreach, connect with our people on Tuesdays at Outreach, harm reduction programming, 1:30 to 3:30. I have a feeling, if I could be real, Debo, if I could be real about this, I think this might be one of the most tough, hardest, emotional Thanksgivings that we're going to have in a minute. I think all of the things in the world are going to kind of come to fruition. People are going to be sitting down and thinking about like how bad it really is. Mm-hmm. I think that's coming down this Thanksgiving.
I could see that.
Right. I don't feel the joy. Usually there's like joy. You get the Christmas music. You start feeling like, yeah, it's a season to come together. I don't feel that this year.
We're in such an uncertain time. We look at the national situation as a whole.
Yeah.
You got this looming Epstein files.
Yeah, listen.
People's ability to provide and eat and and so forth has been in question and certainly in jeopardy.
Yeah.
I'm sure everybody will be made whole by then, but it's you've taken all of the joy
fun
and the spirit out
of
this time of year as we get into that. This is, and then for me, Ebony, just to be honest with you, to hear that the resolutions that they've come up with are only good until January.
Can you imagine
back in this same situation?
Can you imagine operating any other job in the fashion that this government has been? No. So I often kind of shift and think about it in terms of that. If you showed up at work and you're like, hey, listen, I'm only really going to do my job until the next 2 months. And then we're going to have to sit down and you'll have to tell me again about doing my job. And then I just don't feel like coming to work. So I'm not, until you decide to do what I'm asking you to do, I'm not coming to work.
Well, the crazy part is when you look at those high-ranking folks that were holding things up, if you will.
Yeah.
One side blaming the other, but yet they were still taking their paycheck home.
Listen.
But I get to tell you, Ebony, you're going to work for the next 47 days, and I'm not giving you a dime.
For free.
And you better show up.
For free. It's the optics. I always say I'm not running for anything because I'm not built for the political life, but I might have to throw my hat in the ring and run for something because it can't get no worse, as the elders would say. It can't.
Even if you mess up, it wouldn't be this bad.
It can't get no worse. But I'm glad to see that the benefits are back. I hope that the government, from the federal level down to the city level, really starts to understand that although politics is a science, politics is a logistics game, quote unquote, if you will. These are people's lives. And so these are their lives. And so while you playing back and forth, somebody actually was so hungry that they did not eat for a week, right? I want you to really visualize that. Because the money was not there. Then you talk cutting folks' power off. You talk all of these things. So my point is, why have a government then? If we on our own anyway, why have a government? Okay, that's Ebony Civics 101. Don't y'all get me fired up. Because I want to be fired up. I want to be calm and positive and all that. But I hope that government takes away from this whole ordeal. People are people. People will vote. So as the midterms come around, listen, now is the time for action. Less protests, more vote. Which I feel about that. Less protest, more vote. Right. Get people that actually care about us. That's important. Now, right out, I know I'm coming up on a break. So before you throw something at me and say I said go to break, right? Let me just make sure.
No. Go ahead, keep going. We'll let you know. All
right.
Don't you get so that you're gonna try to tell us.
No, because you don't see what he throws over here, and I'm trying to duck it off camera and do the thing. It's not right.
Pressure over
there. Behave. This is a family show. And your fan club plays no games. It plays no games. None. So I've already yelled at the people about getting their vaccinations. We're gonna talk benefits and really what the government shutdown has done. Is there damage? Now, have y'all flown within the past 47 days? Have any of y'all been on a flight? When I tell y'all chaos, and it's a different chaos. I know I've been in we call it the travel avalanche, where these flights get canceled and your flights get canceled. I've been in that with just the holidays. This one was a little different because as I'm looking across the sea of people that are upset that their plane these are the people that might have voted to be in this very situation. So they want to be mad, but they really can't be because they asked for this. So it's like, I'll just sit here and just stew in it. We got to do better. So you know what I went back and thought about? We were on this show in January. It was like our first show after the election when all the executive orders came out. Y'all remember that helicopter crash?
Mm-hmm.
So planes been falling out of the sky since and it's not funny. We got UPS, right? The UPS plane that crashed, and what is going to outrage us As I'm sitting in the airport thinking all these people are mad, I could see it in their face. What is going to be the thing that causes us the most outrage, where we say this is
enough
it.
Is enough.
Enough is enough. Like for me, it's healthcare. You can grandstand, you can stand up and say I'm about making money and it's economics and it's this and it's that. When people are sick, they cannot work.
Yeah, and that's what I was looking at when I was watching this press conference. And
was the one where she was throwing out the money? Is that the press conference? Did you hear about this?
Yes.
They're giving TSA agents $10,000 bonus. And so again, me and my reasoning, right? Wasn't it the traffic controllers that were causing the issue? So why are we giving the TSA?
Which makes no sense, because the traffic, the reason why the planes is grounded is because of the traffic controllers. Like those people that's
in the tower, and they're going, you can land, you can land, you can't.
Yeah, so it really makes no. And then on top of that, you got this clown saying, well, I didn't like Obamacare anyway, and I mean premiums is just going to go sky high, and it's all the Democrats' fault. What? How?
It's about the people. Like I now am in my mama tone, right?
Yeah.
And y'all in here arguing.
Yeah.
Not even arguing. Y'all in here arguing.
Yeah.
Okay, knocking stuff over. For what purpose? We need leadership. We need people that are actually paying attention. We need people that are stepping up and understand how to negotiate. But the people are the thing. Right. This is about the people.
Yeah, and if he really cared about the people, he used the slogan when he was on the campaign trail. Kamala Harris is for them and they. I'm for you. And now I'm asking the question: Who is the you? Who's the you? Is it the you if you are his billionaire friends? If you can benefit him, if you can do something for him, then he's for you. But everybody else, like, you gonna actually try to starve the people, but then say there's no money, but then you give away 40 million to Argentina.
Listen, my again, I have to ask the question, what is going to be the thing that gets the people fired up? I want to know where the interior decorators are that are looking at this monstrosity of gold accents in the White House. I am appalled.
But you do know what that is, and I had this conversation.
Please tell me what that is, because it's tacky, is what it is.
Wait, say something real, Michelle Bryant. Hi, Michelle.
Hey, Michelle.
Michelle. No. What I was saying is, anytime a person spends their own money and put it into something, they want to own it. He don't plan on leaving the White House, and he's showing it. He tore down a wing to build a ballroom, but then he took the floors out and put marble floors and gold trimming. But anytime you do stuff like that, you are treating it like you own it.
I just don't like it because it's not cute. Is that how? That's the level of petty. These little gold accents, to me, could be tastefully done, if there were one or two, but like, they're everywhere and they look cheap. And I feel like it cheapens our government. It cheapens the way the world sees us. And that has economic implications. So I won't go all the way down the nerd tunnel this morning, but I will say how the world how the world sees America is important. And so our mortgages depend on how China sees us. Our minerals depend on how Africa sees us. Our monetary policy depends on how Europe sees us. So we can grandstand and we can do all of these things and talk about how we can make it on our own. But the reality is our government, our world and global policies don't allow us to operate by ourselves. So that's your civics lesson for today. Thank you for listening. Questions, we'll take those. But we'll grab a quick break. You are listening to Community Heartbeat, presented by Outreach Community Health Centers. I am Ebony Ssali. We'll be right back.
action. A new AP North poll shows Americans are increasingly dissatisfied with President Donald Trump's handling of the economy. The survey, taken November 6th through the 10th, finds 62% of Americans disagree with the job he's doing as president. Across party lines, the numbers are even more striking. 94% of Democrats disagree, as do 71% of independents. Trump's stance on the issues is also slipping. On the economy, a central focus of his campaign, 67% of Americans now say they disapprove of his approach. And on immigration, you'll find 57% of U.S. adults are unhappy with how he's handling it. Even among Republicans, there are signs of concern. Earlier this year, Trump had an 81% approval rating on his handling of the federal government. That number has now fallen to 58%. For NPR News, I'm Jamie Jackson.
Here's your updated forecast. We'll see sunny skies here for today with a high in the upper 50s. South winds around 5 to 10 miles per hour. Then for tonight, increasing cloud cover with a low around 50. By Saturday, skies will become mostly sunny with a high around 63 degrees. And Sunday, sunshine high of 46. Monday, we'll see some sunshine high 43. Tuesday, slight chance for rain early, partly sunny skies high of 43. I'm meteorologist Jennifer Wojcicki at AM 860, The Voice. Craving something sweet? Step into the flavor of a good old-fashioned bake sale, Quick Trip style. We're serving up smiles with our creamy donuts. Choose from Quick Trip's fluffy long johns, rich croissants, classic biscuits, or ring donuts. So delicious, just like the ones you find at your hometown bake sale. Craving those fresh, oven-baked cookies like Grandma used to make? The quicker is gone. All the goodies you need to satisfy your sweet tooth. So what are you waiting for? Head to the bake sale, only at Quick Trip.
Contract written business opportunity seekers, partnership, visitors, deal closers, marketplace Wisconsin, the governor's conference on diverse business development is focused on you. This event puts small businesses like yours in the room with buyers, partners, and mentors who can open doors to bigger opportunities. Join us online December 9th and in person December 10th and 11th at the Bear Center in Milwaukee. Whether you're a construction company looking for contracts or a service provider ready to grow, Marketplace Wisconsin is for you. Meet one-on-one with government reps, corporate buyers, and resource providers. Small businesses like yours keep Wisconsin moving forward. Wisconsin Economic Development Corporation is here to propel your growth. Let's look forward together. Register now at Marketplace Wisconsin. Milwaukee Southern Soul Cool. By tickets out there now November 21st at the Turn On Field Arsenal in Milwaukee. So fact, get your tickets now at theaters.com or at the box office. For more information, call 414-793-4556. 860 AM 106.5 and WNOV. The Voice.
by outreach because it is not even show. This is a movement. Friday. Listen, during the break, we talking about the good old church. The and I thought the conversations about church and how faith is showing up in this moment to meet this moment, I thought was really interesting. But we started talking about ministries in the city, and I've shared this before. I came up in the Baptist church, Ursher board, the choir. She got a little something. She don't bring it out all the time, but she got a little
thank
something.
God.
And a good Easter speech, baby. That's where it began. Okay. Because what Ebony is going to do is going to present remarks for the afternoon program. That is what she is going to do. But shout out to all the faith leaders. This is not a time that can be easy, really, for anybody. But the things that you do, you get up, you inspire the people. Let me just take a moment to say thank you. I will say, too, I have joined with Outreach one of the interfaith coalitions because I think I'm going to take it back to health, wellness, energy, our faith communities, all that stuff is connected. So I want to make sure that we're putting resources in churches as people are showing up, that they can be healthy and well. So if you have a ministry, want to get connected, want some resources, we have a mobile unit. If you want to get connected to that, give us a call, 414-727-6320. Give me till after 9 a.m. Okay, let me get back to the office. And let's talk about how we actually go through and change the world, right? Let me get my notes up, y'all. I feel like y'all got me working for real today. Can we get into rest? Can we just talk a moment about rest? Right? Are you resting?
Oh.
Are you resting in the Lord? Ring the bell. Are you trying
I am resting in the
Lord.
Lord.
What are you resting in? The sweet peace of the Lord.
Well, sometimes you gotta just lay there.
This is a family show,
and
right?
Just rest.
This is a family show. Listen, Ebony, I will talk often. Ebony will sleep. Ebony will get that rest. My watch has been on fire this week. It's like, baby, please slow down. Please rest. Because a lot has been going on. But last night, when I tell you, I was in bed by 6:37.
Sound like you got some good rest. Yeah, that's that good sleep. That's to turn off all the lights, TVs off.
It was warm, rubbing my feet together. Listen, it was a moment. Yeah. Let this be a season of rest. I feel like we've gone hard this whole summer.
Yeah,
we've been doing a lot. Yeah, can we rest?
Can
we rest?
I believe that just taking the season to slow down. It's good for the soul. Yeah. It's good for the mind. It's good for the body.
Yeah.
Just even biblically, it said he maketh me lie down.
Listen. Listen, okay, but
that's just like somebody used the scripture out of context. He making me lie down. I gotta go rest.
But I will say this: I over the past 2 weeks, I've been on many adventures, which I like. So I was at Holy Hill doing a hike out there and doing the stairs and looking at all the fall colors change. And I'm like, God is kind of amazing.
Oh, super dope.
God is kind of amazing with all this beauty. So just to take a moment to look out and acknowledge God in all the forms, I just thought was an amazing time. Yeah, so
it's amazing.
Yeah, God. Holy Hit for real. I'm like,
yeah,
wow, God is for real. Yeah. So we got a caller. Greetings and good morning.
Good morning, Miss Ebony. How are you?
I am fantastic. How are you this morning?
I am your number 2 fan.
Listen.
Thanks for coming from behind the booth at the facility and shaking my hand. That really meant a lot to me.
Listen, my beautiful sister. Give me your first name again.
It'd be Kiki from the north side.
Kiki from the north side.
I had to fight Miss Angela because she was hogging all your time. And I had to say, move, get out the way.
I told you Angela be on point. But no, it was so good to meet you. So good to meet you.
I just want to shout out Outreach for having you represent them. You were engaging with the crowd. You didn't just go to the meeting and stand behind the booth with a stone face. That was really, really welcoming. And thank you, Outreach, because I did send my husband there for his podiatrist appointment.
Listen,
and
don't we love Sutter Robinson? Don't we just
yes, I just need to follow up with him, make sure he go back for part 3. That's the only thing with that. But thank you, Outreach, for even being on WNOV and having Miss Ebony represent you. And my question, I know you're not a doctor, but I just got over, but you brought up the vaccine.
Yep.
I got over something real weird a couple of weeks ago, like, the shakes and aches and all that. So would you still recommend people go get the flu vaccine? Or is it, we already got it, so never mind now?
I would. And like I said, it's in the small interactions. Like I was on the plane and I got 2 people on this side and I'm talking cough and sneeze and 2 people on this side. And I'm just like, you're sitting in the middle of that. So even, and then when they get up and leave, you come sit down. You don't know that they've been coughing for 2-3 hours, right?
Yes,
so I say get it. At the worst case scenario is you don't get sick again. Right.
Okay.
I mean,
all right.
So yes. Do that.
And then you talked about faith leaders. Yeah. I also thought about you because there was one faith leader up there. His teeth was whiter than yours, Miss Ebony.
Just bing.
I was like, wow, he must be listening to the show like we listen to or something. But that was beautiful to see and motivating. But again, thank you for being on. I listen to you faithfully, and I love you, Miss Angela. But you got to give her some space, man.
Miss Kiki is in the building.
Kiki, do you love me?
No, and again, it was really a pleasure. I think when we start doing this work, we hope that on the best case scenario, we're connecting with people and that they see that we're real, right? So I had a decision to make when I started this particular show. Would it be something that was so serious that the people can't hear you, or just sharing the information? Because we're all trying to get through it, right? We're all trying to do our absolute best. So thank you for listening and being engaged. I appreciate you, Miss Kiki.
Kiki, do you love me?
Indeed. Let me see. Did we have another caller?
Oh, yeah.
Okay.
You got
Did they come on in?
Yeah, they just come on.
Okay, come on in the room. Mm-hmm. There is peace.
Oh,
in the room.
Oh, my.
Listen. I thought those songs were wild back in the day, but I love them.
Oh,
I love them.
The
joy. All right, we'll take that next caller then. Greetings and good morning. Welcome to Community Heartbeat.
Good morning, Ebony. This is Angela.
Good morning. Listen, Angela, you hear Miss Kiki?
Yes, ma'am. That's why I'm calling.
Kiki, I love y'all.
Miss Kiki. Girl. It was so nice meeting you that day. You can have the space you need. I ain't like that. But just know I'm got it sold now, so just take a number.
I love y'all.
And when it's all over and done with, you got your time. Thank you for giving me a shout out, Miss Kiki.
I love it. I love it. Thank you so much, Miss Angela.
You're welcome, Miss Ebony. Have a good one.
You too. Listen, and that's really what it's about. Yeah. It's about community. Yeah. It's about the family. Y'all keep me giggling. Y'all keep me laughing. So I appreciate it.
See, but you know what? That's the beauty in this whole thing of having this this remote broadcast.
Yeah.
Because the people, they build a friendship through radio, just listening and calling and laughing and talking and sharing their stories. So then when they get to meet you in person and see how sweet and wonderful people are.
Let me fishing for these compliments. No. You right about it. And I will say this. I tune in to Michelle's show on those days where I'm just getting out of the house.
Yeah.
And she be having me so fired up. I'm like, calm down, Ebony, in the comments. Calm down, Ebony, in the comments. But I have my little notebook like, is she right? Yeah. So let me pause and say shout out to Michelle. She was phenomenal at the resource fair. She also showed up. We had a press conference later that day.
Okay.
So with Senator Tammy Baldwin, the Affordable Care Act. She came through outreach just to talk about what those cuts mean in healthcare. So Michelle showed up and made sure that she represented NOV. So just shout out to her for always moving and shaking. She tries to be behind the scenes, but I'm like, hey, Michelle, right? And thank you for just carrying us, giving us the knowledge of what needs to be done. So I appreciate that. Appreciate that for sure. And it was good to see the people. Miss Kiki came on through. She was like, hey. Yeah. Yeah. And Angela came through. I got to meet a couple great new people as well. It was a phenomenal time.
You just going to keep rubbing it in, huh?
What am I rubbing in? We're going to make sure that you're there next time, right? I don't like that was Juneteenth.
Yeah.
They didn't free, so I'm going to do some t-shirts.
I tell you what's going to happen is you're going to see a whole picket line next time y'all do a remote. It's going to be my picture on a stick.
Free ride out. Free ride out.
On the church fans.
That domain is taken. Hold on. Let me. I might make me a little side hustle on
the church fans. Free ride out.
But no, I think anything you're trying to get to the community through the churches, I think is a great. So to get back to that, if you're a pastor, if you lead a congregation, if you're a minister of any kind, just share with me how you getting through this and what messaging are you giving to people, because these are dark times. I think we're gonna look back and say we survived that.
I made it.
We survived that. Yeah. So talk back to me in Milwaukee, 414-444-5250. Tell me how you change in life. What's different? This has been the longest 10 months, 11 months of life. Man, it feels like.
Feel like 50, 11 months.
I'm saying
50, 11 times, 50, 11 months.
I'm trying to get all of my health screenings done. I will say this. I know that premiums are about to skyrocket. We had 2 people in during the press conference, and one works for herself. So we all know about that side hustle, working for yourself. She said her premiums on the marketplace will go from about $300 a month to well over, I think she said $1,600, something like that.
That's crazy.
A month, right? So what do you do for food then? Right? Because food is high, rent is high, gas is high, energy is high. So then you think, well, I'm gonna work remotely, but your energy bill is 3 times what it used to be. Cut them lights off.
Yeah.
Cut them lights off.
Cut
them lights off.
Teddy Pendergrass.
Right? Don't do it. Do it right. I know you want to do it. Don't.
Turn them off. Felt that thing.
All up in your spur. All up in your spirit. But no, it makes you think, like, how do we get through this? This is for real.
Yeah.
One of the things from the business community that I don't think we're talking about enough is how many businesses are closing. Now, quiet is kept. You go look at the reports, look at the employment reports. People are losing their jobs. So I'll do a shameless plug here to say that outreach is going to stand in that gap for you. So you're losing your job, you're losing your coverage, which I think that's a whole different soapbox to stand on. Your benefit should not be connected to your employment. Because what if you work in 2, 3, 4, 5, 17 jobs, right? How does your healthcare, how do your benefits work? We have a sliding fee scale. So what I want you to take away, if you take away nothing else from this show, do not let your ability to pay or inability to pay stop you from getting health care. Now, I'll fight right out on the vaccinations. We'll do that. If you have a reasoning why you're not doing something, I can rock with that. But don't let you looking at your bank balance keep you from getting health care. I don't want you to do that. So outreach is there. 220 West Capitol Drive. Open from 8 a.m. to 5 p.m. every day. So come on in, see us. Pharmacy, dental, primary care, behavioral health. We got it all. Right out, how you feeling about the pharmacies closing and all? See, we're not thinking about how this thing is compounding.
Yeah.
Folks is gonna be off their medication.
Man, and that's
heart medication.
You know, that's the
diabetes medication.
That's the scary thing about it, is because, you know, you look at the not only the elderly, but just, you know, people that have, you know, complications and medical issues. Yeah. And, you know, you just look at it and be like, okay, why are you doing this to
the people?
To the people.
Now, I do have to do a caveat here, because I'll present the topic with levity, but this is real serious. Yeah. Okay. Now, there's a health clinic that tests for STIs, shuttered this week temporarily, so they will reopen. Now, Word on the street is these rates out here, that Miami behavior is what I'm gonna say, because it's a family show. That Miami behavior has these STIs, that sexually transmitted infections and diseases. The numbers are crazy. The numbers are crazy. So let me say this: outreach, community health centers, tests, and creates treatment plans for sexually transmitted diseases. This is not the time. If you ain't got a cupcake yet, let's leave that alone. But please do me a favor. Do yourself the biggest favor, as DJ Khaled would say. Go get your tests. Go get your tests.
Man, listen.
Go get your tests.
Yeah, because
it's a hotbed of
debauchery.
Pestilence.
A hotbed of affliction.
There's a whole lot of affliction out here. A whole lot of afflicted people.
No. So like I said, I will put levity to it, but the rates of sexually transmitted diseases are high. And if people cannot get tested, that means they're just out here. So if you at the club, and you're not sure,
err on the side of caution.
Err on the side of caution. As big sister, little sister likes to say, don't be driving on the road without tread.
Man, listen,
don't do that. Don't do that.
Yeah, because you
mess
around with the itchy yayas.
Itchy,
yeah.
Vamos lá, calula. Violete, mamola.
Walking around with the itchies.
Yes, Lord.
Look, I'm sorry, Mom. I'm Mom.
Itchy, yeah.
You say the next part. I don't know what they be saying.
Oh, you know what it's saying. It's saying that itchy.
Violete, mamola. Mama didn't lie.
Get your health and wellness together, which includes your sexual
Y'all wrong
health.
this morning.
Come in and get tested. Quick, confidential. But it's a lot going on out here. So please protect yourself. In the words of the illustrious Wu-Tang Clan, protect your neck. You are listening to Community Heartbeat.
Wrap it up, campaign.
Presented by Outreach Community Health Centers, your home for testing health and wellness of your body. I'm Ebony Ssali. We'll be right back. Welcome back to Community Heartbeat, presented by Outreach Community Health Center. Not just a show. This is a movement dedicated to bringing our communities together through wellness, keeping your heart pumping with positivity. I'm Ebony Ssali. We're here talking STIs. We're talking about making sure that you're healthy and well. Get to Outreach 414-727-6320. Get yourself tested, okay? Because
everything. Everything.
Yeah.
Full panel.
Full.
Wow.
Full. So when you go on vacation, get tested before you go. When you get back from vacation, get tested. Okay. It's because listen, the numbers are crazy.
In which you mean like for disease?
Yes, the sexually transmitted
airborne
diseases.
Stuff. Yeah. You potentially could have. Well, why would you say sexual if you and your spouse are? Never mind.
The data. Listen, the data says otherwise. So we can.
And also, STDs do lie dormant for years, decades even. So
we're not playing.
It isn't always that they did something recently. It could be old.
Ooh,
but
the old creeping.
But guess what?
that messed up your whole.
You know,
now you think about that one time and that one little
Ebony, y'all know good doggone well. If I said, baby, that was the doctor said that was 10 years ago. That's before we got together.
Yeah, you gonna get those bullets.
You don't think I'm stupid.
Yeah. You're not wrong.
Nobody's buying that.
Listen, you're not wrong.
Right.
Listen, no excuses is what I'm saying, y'all. No excuses.
So name one just out of curiosity. You know, the itchy that could lay dormant.
That's like syphilis, HIV. Right? Oh, okay.
HIV.
Okay.
Really?
Absolutely.
See,
my old office mate ran our HIV program, so I learned a whole lot about that.
Okay.
And yeah, absolutely, that is normal.
So you can actually carry the virus and not show any symptoms.
Yeah, it can lay dormant.
So is that okay? So what's the difference between HIV and full blown AIDS?
So it's an immunocompromised virus. So one is just advanced. So you typically you get HIV first, and then it progresses into AIDS.
Listen here, look. Let me do the proper introduction, and we jumping right back into this. Y'all like who? So we welcome it back to the show. Brandy Lewis, Outreach Community Health Center. She is our benefits manager. Growing up in the community that she serves, Lewis has always known that she wanted to help others. Working for various nonprofit organizations for over the past 20 years, she has equipped herself with a multitude of skills that she uses to help, assist, and educate. In addition to serving as the benefits manager at Outreach Community Health Centers, she is also a local lead for SAMHSA's SOAR program and a certified trauma-informed care trainer. Because y'all credentials, y'all know how I love me some credentials. She has a Bachelor of Arts degree in psychology from the University of Wisconsin-Milwaukee and a Master of Science degree in counseling from Concordia University. She has a true passion for behavioral health and shining a light on understanding mental health from a trauma-informed perspective. She takes pride in serving the underserved and is committed to bringing awareness around the topic of mental health. So welcome to the show. Welcome back, Brandy Lewis. Now she got us right together. You listen, she is that girl, ladies and gentlemen. She is. So we were talking about STIs. And so I mentioned that one of the clinics here in the city temporarily doesn't have the staff to cover those tests. So I shared that Outreach is a resource, and you just jump right in like this is what's happening. But I wanted to make levity of it because it's one of those conversations like when you bring it up with the family, everybody get real quiet, but it's something that we have to do. So just like we have to go in to check our heart, you have to go in to make sure you are not carrying sexually transmitted diseases, infections. We don't judge what you're doing in the hotel and doing the things. We just saying keep it safe. Keep it safe. Now, Right Out done shared some information that I gotta go and research today about the secret pages of Milwaukee and the secret things and such.
Listen, they out here, man. I'm gonna show you.
I had to put my hymnal down to hear what you were saying.
Yeah, I'm gonna show you. It's
Lord.
Unbelievable.
Lord, listen, please protect yourself, Milwaukee. Like for real. You just don't know nowadays, right? And Brandy, you were sharing some 20 years ago, 10 years ago, 5 years ago. We all took a pause and thought about that one Not me, Mom. Not me, but I'm just saying I'm here for the people. Not me, but I'm just saying, right? But Brandy, I wanted to bring you in today because it feels like the world is falling apart with these benefits. It feels like the things are happening. And so just as I shared that I am not a physician, even though I have watched 20 seasons of Grey's Anatomy, so I'm kind of like that, but I'm not. I hear a little bit about the benefits, but it is truly the professionals that get it done. So the world is on fire with these benefits, Brandy. First off, first off, tell us what you do at Outreach. So in your own words, because benefits can sound scary.
I do
Everything,
so
what needs to be done.
I manage 2 different teams, Ebony.
Okay.
I have a team that strictly helps people get Social Security disability.
Okay.
And they do that via the SOAR program that you talked about.
Okay.
And then I have a team that is certified by the state to help folks get their health insurance. So they're doing Medicaid enrollments, food share enrollments, the various different Medicaid programs that are out there, like your QMBs, SLMBs that pay for those Medicare subsidies. And then they also help with the federal health insurance marketplace applications. I am a payee. I do all different types
you
of
do
things,
it all. So we know that open enrollment just started on November 1st. Tell us, what is open enrollment? Like, we hear it, we see the commercials, it's up on the Outreach website, but what does that actually mean?
Open enrollment is pretty much your only chance to shop for independent health insurance that's not connected to an employer. So that marketplace is only open from November 1st to January 15th. Every year. So if you don't have a special enrollment period, like you had a baby, you moved, you changed your jobs, this is pretty much going to be your only opportunity to shop for insurance
until the next year.
Next year, or you get a special enrollment situation, or a life qualifier, we like to call it.
Okay. And look, based on what's happening in the world, we gonna wait to have those babies. Just a minute. We just because everything is so in flux. So how does your team I walk in, let's say I don't have benefits, I lost my employment, I'm out here, I'm stuck. What's the next step?
The best way to go about it is to call us, but we do have walk-in hours Monday through Thursday from 9 to 1. Otherwise, you would just give us a call at the number that you provided, the 414-727-6320. Some folks may have our old number. The 374-2400. They both work, guys. They both work.
Okay.
And so they would just ask to speak to benefits, and they would get you over to us. And then one of, either myself or someone from my team is going to give you a call back to get you scheduled, just depending on what it is that you say.
So one thing I like to share with people is you're looking at the entire person. So if it's like a pharmacy benefit that they might be able to get through Medicare, or if it's they qualify for food share, but they haven't taken advantage of that, like, you're ushering them through that process, right?
Yeah, absolutely. So benefits is kind of like a catch-all at Outreach. So we do an intake assessment. So we're going to see, like, hey, do you have a primary care doctor? Do you have a behavioral health doctor? Do you want one? Do you have a case
do you
manager?
Need one?
Do you want one? That kind of thing. So, we're kind of doing a one-stop shop and providing those resources as they come to us.
I love it. So when I tell y'all that we got you, I mean that we got you. So there are professionals in place who really, really do this and really, really love this. So this is your lifeblood. This is where you're from. These are your roots. What drives you personally to do this work? Like,
honestly, I love Milwaukee. I love where I live. I love where I work. I love the community. And honestly, just to get a chance to help people that look like me. And oftentimes when I work with folks and they say, well, I didn't get good service at this place, or I didn't get good service at this place, that's really what drives me to do what I do. Like, I literally love helping people.
Yes. And listen, you have to have that component, I think, in any kind of service industry, in any kind of place where you're you're directly impacted, and your attitude, your emotions, your professionalism affects people, I think you got to show up and do that. You got to love the people. So,
well, I'm also the trainer for our Power of One.
Come on.
Is, we at Outreach, we provide A-level service. Yes, so that is, it doesn't matter who you run into in our building, you should be getting A-level service. And if you don't, come let me know, because I train
listen. and that's real. I think too, we've had a few callers that have called in and said, you know what, I didn't get it all the way right. And I say, continue to do that. Continue to give us the opportunity, but call it out, because we get that corrected really quick. Right? It's like, if you're not giving 110%, that will be corrected.
That we don't have faults. Everybody has days, but definitely give us an opportunity to correct it, and make it right.
I love that. So how did you show up in this work? How did you decide, like, this is the thing? Because I know, look, little Ebony was like, between the Easter speeches at church and watching the TV shows, I'm like, I want to be Oprah. I like that. So I knew this was the work I wanted to do. But how did you decide that you would dedicate your life to this?
It was just a culmination of a lot of, I've done a lot of jobs. I've been a driver's ed teacher.
Come on, with the little simulation.
A CDL teacher, really. Okay. I worked at Milwaukee Community Service Corps, where you help, our youth get their GED. I was a GED teacher.
I can see that. I can see that.
And it just, the more jobs and different roles that I took, it just really started to be like, you really love to help people.
It's about the people.
My uncle and my grandfather for years ran a boxing club out of the King Center.
Okay.
And I helped them write grants and, pass out popcorn from 5 to 6 years old at the rave, passing out popcorn at these boxing events. Right. I love to help people. I've just always been a helper, just a doer.
So this is like second nature to you.
Absolutely.
Doing this work.
I don't like when people say, oh, Milwaukee is this or that. It's really bad. What are you doing to make things better?
Yeah.
Other than complain.
Yeah. And look, just some people, that's all they're going to do is complain. So we have to just take that. Thank you for your feedback and move on. But I love the people that are really dedicated to it. So again, that's why I'm at Outreach. A friend of mine called and was like, I know you love this work. Outreach needs you here. And it was like a done deal.
And you've been great ever
since. And look, but again, I love the people. So I'm going to make sure when it comes to how we're represented, the information. So even this show is about how we get information. We will listen to the radio. We are connected to this community. So what we share here is important to us. So 20 years, when I read the bio, I was like, she ain't even 20 years old. She can't even be.
My birthday was at the end of the month.
Look in here looking flawless. Okay, drop the skin treatment, sis. Don't gatekeep. Don't gatekeep. But 20 years in nonprofit. How do you think that helps you do what you do every day? So having that history, having that experience, how does that help you deliver services at Outreach?
I've come across all walks of life, and it just really just allows me to be impartial and non-biased, and just kind of really look at people for who they are, because everybody has a story, especially doing like the SOAR work that we do. We came across a gentleman and he was homeless, and the SOAR work, we have to really just kind of dig into their past and see what type of jobs that they did in the past. And we're working with this gentleman, and it comes out that he used to be a professor at like Cornell University. Very intelligent man. And unfortunately, it was just like his mental health he said he described it as somebody just turned the lights off on him. And he struggled ever since. So you just never know who you run across, and so I've just kind of learned to treat everybody the same. Everybody deserves respect.
Look, come on in here and preach, Pastor.
It just is what it is. And I think a lot of times when we're in social services, because people have burnout, they're overworked, it is really easy to fall into that trap to just be like, I'm just here to get a check. So I've just taken all those lessons and kind of applied it.
Because it really I love what you said. You never know what someone else is going through, but if you treat everybody well, then you'll have to worry about it. Right. And everybody has a story. For sure. Okay, so background in psychology. Hey, I love it. How the mind works. I just put it to the commercial side and said how the mind works and then what people buy. But that is your thing. So the psychology, the counseling, how does having that particular background help in work that you do? So I think there's a certain level of compassion that comes through any psychological knowledge, right? You learn how people think, how they move, how they operate. How does that help you in the work you do?
Oh, it actually, me being a trauma informed trainer, I think is what helps me the most. So,
Okay.
Being able to look at it through a trauma informed lens, one of the ingredients that I teach about is perspective shift. And once you learn how to shift your perspective or how you see people, it changes the way that you treat them. So one of the slides that I have is I show folks a photo of a piece of moldy bread. And I say, if you were sick, would you take this piece of moldy bread or would you take this penicillin on the side? And most folks obviously are going to say, I'm taking this penicillin.
I see what you did.
And then I say, well, what would you say if I told you that these were essentially the same things? Just one
you
looks like you shouldn't
I'm
be
like,
eating
oh,
it.
she's smart. Okay.
And the other one is a pill that the doctor gave you, but they do the same thing, but it's how you look at it. Right. So if I can change the way that you see things, it then allows you to interact with people just on a better level. And then on the flip side, when I'm dealing with patients or clients, if I can teach them how to regulate themselves when they're in the moment, if I can just take a deep breath and I can maybe count backwards from 10, maybe I might not slap this person.
Listen, because we all listen. I know Ebony being here smiling, but every now and then I'm like, ooh, please go take a walk, Ebony. Right.
So it's just just knowing these tools and just being able to steer folks in the right direction. And I also have an MBA, Ebony. I don't know if you know that or not,
because
but I do.
Wait, in addition to the Master of Science. Go and pop your collar.
But that allows me though to write grants so that we can sustain these programs. We have to have the money, the funding to be able to help folks. So like through our SOAR program, we waive the fee. If you go and you ask a lawyer to help you, they get 25% of your back payments. If you come and you see us at outreach, we waive that fee. So all of the back payments go to you. They go back into the community.
Y'all better call Brandy 414-727-6320.
We have a wait list, but it is worth the wait.
Is what she knows what she's doing. And I promise you, Milwaukee, if there is anybody in this time and space that we should be elevating, is people that have dedicated their lives to this work. There's people that have taken the educational side to this, because although we like to say, yes, some industries you don't need to go to college. Sometimes you do need to have your head in those books. You need to understand the theories. You need to understand what that. So Brandy got it, is what I'm saying. 414-727-6320 to connect to her. Open at 8. Give her some time. We got a little bit of a wait list, but get on that wait list, as she said. Definitely worth it. Now, this is one of those things that I think I wanted to make sure that I asked, because some people are just hesitant to ask for help, right? The superwoman complex, the superman complex, they got it. They've never been in this situation before. If we took the professor, right, you come from a certain level and then you kind of lose access to that level. That has a whole mental shift to it. So if someone's hesitant, I want them people all in my business. I don't want to, how do you nudge them? How do you urge them? How do you encourage them to come on in?
Well, the first thing that I kind of explain to them is, you're running on E, and eventually the car is going to stop because there is no gas in the car. If you're not pouring into yourself, you cannot help others. You can't function. You're going to be dysregulated. So I think that the minute that you kind of recognize, hey, I'm not really feeling like me, we have to take a step back and really kind of address that stigma and that shame of accessing services, because
that's what we're here for.
We
that
would not exist if you didn't have the need to come and see me. I wouldn't have a job if everything was okay with everybody all of the time. So I really think it is just getting over that mental complex of, I do have to be strong all the time. we are not.
Listen, we are not.
We are not always,
and we don't have to be.
And it is best to reach out before it gets too bad, because the thing is that everybody has wait lists, right?
Yeah.
And so it may not be immediate, but if we get ahead of it, by the time it kind of gets that bad, more often than not, you're kind of in there or connected.
So people should make a plan for, okay, so let's say new year, new me, right? People start the year that way. They should start calling now. Get on the list, okay? Because we know Christmas, holiday, all of that's happening. Get on the list now. 414-727.
Even if you're on that diet, start now. If you're thinking about starting a diet on the first, start now.
Ooh, Lord, why you all up in my video? You all up in my video, Brandy. I just gotta look that one last cheeseburger. That one. I just need that one. With one last one. Right. So if you have benefits questions, let me preface this before I say it all. If you have benefits questions, give us a call. But there may be some instances where Brandy got to see all of your information. So if you got a quick question, 414-444-5250, open enrollment, benefits, Social Security, give us a call this morning. Question for Brandy. But keep it consistent, because not consistent, concise. That's the word I wanted. Because listen, she got MBAs and degrees. She said, which degree you need to see today? That one. And I love it. Brandy Lewis, Benefits Manager, Outreach Community Health Centers. I am Ebony Ssali. We'll take a quick break, but when we come back, questions, and then we'll pick it up with Brandy Lewis. We'll be right back.
I don't remember the A.
Okay, got you.
Okay.
Okay.
It's a lot of acronyms. I can tell you what SOAR is.
Okay, what's SOAR?
SOAR is SSI, SSDI, Outreach, Access, and Recovery.
Okay. What's all that? What? So I show up at your door and I'm like, I heard you talking about the SOAR program. What is that gonna do for me?
So the first thing that we have to do is screen their housing situation.
Okay.
So historically, SOAR is for those that are homeless or at risk of homelessness. Wisconsin had like a 10-year plan to end homelessness. So that kind of changed the scope of the program because most of the folks that were coming to us were housed.
Okay.
So I play around with that at risk of homelessness. You know, if you don't know how you're going to pay your rent next month, that to me, you're at risk of being homeless.
Okay.
If you have a voucher that is, paid from, you're at risk of being homeless. If something happens and they're not able to pay that voucher, the housing falls through. So that's kind of how I get around that piece.
Okay.
And there has to be a persistent mental health disorder, and it needs to be primary. So you can have physical stuff going on. It just needs to be secondary to the mental health piece. So if you are someone that does not have that mental health piece, we would just do a straight application. So we can still help you.
So you know what you're doing. Yeah. You figure out what pieces work. So let me ask, just in terms of the persistent mental illness, are you seeing numbers go up, go down, pretty much stay the same? Just when you think of like your workload, is this a problem that's getting better, getting worse?
I feel like it's slightly getting worse.
Okay.
In terms of Social Security, we're seeing wait times be 14 to 16 months just to get a yes or no. Not
what do you do in that time?
That's not even appealing the decision. That's just to get a yes or no. And then programs like IDAP have changed their program rules. When I first started doing this, anybody could apply for IDAP as long as you had an SSI or SSDI application in. But now you have to have been denied before they even will accept an application from you. So, the resources are really limited for folks that are in that pocket and that waiting period. So it's gotten.
Got you. Tell me this before we take this caller. Someone who actually like doesn't know, like, I don't know what situation I'm in. I just know because there's the mental load of all this stuff happens kind of in succession, or I'm losing my job, I'm losing my benefits, I'm losing this, I've got mental illness, it compounds. What do I need to bring to that appointment? That first appointment that I'm going to meet you.
Tell folks just to bring themselves.
Okay.
I mean, if you have any documentation on your medical history, but honestly, a lot of the folks that come to us don't have any medical history at all.
Okay.
And so in that instance, because I am an LPCIT, so I am able to do many health assessments, right?
Okay.
Just to kind of gauge where they are. And then I'm able to do like a referral to our behavioral health department, and somebody will see them in 6 to 8 weeks. And in that meantime, they're on our SOAR wait list. They're about to be matched up with the SOAR specialist, and usually it happens right around the same time. So
you got the people. That's the thing. You got us. So we'll take this caller. Greetings. Good morning. Welcome to Community Heartbeat.
Good morning.
Good morning.
I have a question. What's the young lady's name again?
This is Brandy Lewis.
Okay. Good morning, Miss Lewis.
Good morning.
I have a question. It was an incident with a family member of mine that's of age 18. So he was trying to commit suicide, and then they had him put into a establishment for mental patients. But I'm trying to understand, because even though the person is 18 and they wouldn't give no information to the parent and starting him on medication, this is a kid in our eyes, but even though they say he's grown, but how can you do that without letting the parent know, well, this is what we're going to put your son or daughter on, even though they 18?
Yeah, unfortunately, in the state of Wisconsin, because they're 18 years old, they have autonomy over themselves to make those medical decisions. And in certain instances, even if they're age 16, like if I'm their therapist and they're seeking AODA counseling, I can't tell you that information.
To the parent,
to the
you can't
parents,
tell. Okay,
to the parents
okay,
even.
okay.
Unfortunately,
Okay.
right? Because there are just certain things that they do allow teenagers to have control over for themselves, especially with him being 18.
Right.
You're gonna have to kind of push to be like his legal guardian, even though he is 18. He may need still a guardian ad litem or a person that's making decisions on his behalf. But unfortunately, that is like a legal process that you have to go through.
So, in order for the person, the parent, even though the man or woman may be of age, in order for the parent to find out what they're doing with this child, she would have to go to court or something,
or the 18-year-old would have to sign a ROI. If he signs that release of information, then they would be able to communicate that to the parent, right? But unfortunately, I've seen it where the kids don't want the parents to know what's going on, so they're going to refuse to sign that. I don't know if that's his situation or not, but
okay. So, but what if this kid's not in his, like, if he got his mind not right? So how he gonna say, well, I'll try this medication and I'll sign this and I'll sign that, and he's not in the right state of mind?
Yeah, absolutely. That's kind of a dead pocket in this industry. Because typically you would either, it happens about 16, 17 years old, but it can go into 18 and 19. But typically when we see this happen and it happens at 16, 17, then the parent can push to have that legal control, right?
Got it.
So that when he turns 18, it's not that issue. But because he's already crossed over,
it shouldn't be an issue. So I'm going to say this. Let me give the number 414-727-6320 with some of those cases. Because, I always say if one person has a question, there's got to be more questions like that. Make the appointment and come in and see.
Yeah, okay, thank you.
Thank you. Appreciate you. It's super important. So knowing that each case is a little bit different, come in and get that expertise. Again, I this is the hill I will die on. Having experts that understand what they're doing, that know the system, that understand, will help you navigate. For me, is everything. So come in, let Brandy look at it, let her team look at it, and figure out where it needs to go from there. So let me ask you this: in terms of barriers, right? We know that there are roadblocks in every industry that just make it more difficult. From the communication side, the government has given us a list of things we can and can't say and words that we can and can't use. I'm like, I thought this was freedom of the... never mind. Are there any barriers that you see in your side of work that make what you do more challenging?
Absolutely. We talked about the shame and the stigma already. I think that's a big one. If they're just too embarrassed to seek out that care, or even family members often give people a hard time about seeking care. So I think unfortunately friends and family can sometimes be one of our biggest barriers.
True. Very true.
And another thing, I think in the community that we live in, and this is just feedback from patients that I've worked with, a lot of times because their providers don't look like them, they're not comfortable, disclosing much. They're not, like really honestly being truthful because
they feel like somebody will judge or
I think that has a lot to do with it, that they're not really getting care. And that's why outreach is so precious to me, because you can get some of everything.
Listen, on the days where it's rough, and again, I say y'all see the Ebony smile and all this, but Ebony have her days too. She's like, I just want to rest. I don't want to have to save the world today. But it makes a difference when you get up and you work with people who are like relentless, is what I'll say. We're going to get it done. Yeah. We're going to figure out how to get it done and have everything.
And then I also think that, like you said, that I have to be strong, or I'm too old to have anxiety or, to be going through depression. A lot of times we are our biggest enemies.
Critics, right?
We are our toughest critics for sure. Right. So, a lot of times we are our own barriers to care, and just feeling like, I can't access this for whatever reason. We're not in high school anymore, guys. Nobody is looking at you. You can come in. It's okay.
And half those folks don't worry about you anyway. I had a real humbling conversation this week, and the sentiment of it is that nobody's thinking about you as much as you think people are thinking about you. Like I don't wake up and immediately start thinking about other people. I got my own stuff I'm working through. So if you're feeling like, oh, I don't want to go because people going to judge me, and I don't want to go because number one is the confidentiality, right? So being a health center, there's confidentiality, but they're professionals that are here. So whether that's pharmacy, whether that's behavioral health, these are professionals that help you get it done. So I absolutely love that. Let me ask you this. What's like your vision? So if you could sit in the highest seat in the land, in the Oval Office, and like wave a magic wand and have all the benefits work out, giving access to people, what would you do? Like, what would you change in the industry if you could?
Honestly, so much.
Okay. Okay.
Much. But I would start with food insecurity. Okay. Everybody deserves to eat.
Come on.
And eat what they want.
Yes.
We're doing all this back and forth, and you shouldn't be able to buy soda with Quest card. Like, let people live. Sometimes that's the only treat that they may have.
Listen.
Why are we just so sometimes? With other people. And then access to healthcare. Because for me that is bottom line, bare minimum. Health,
food and health,
shelter. These are bare minimum things, especially like if you think about like the hierarchy of needs, right? So I can't fulfill myself,
my highest self, until I have food.
If I have a place to stay, I don't have anything to eat. I'm cold. I can't think about pulling myself up by my bootstraps because I don't have any bootstraps to pull up because I'm hungry. Feed me.
So very true. And I love what you said about judging how people spend their stamps and how they spend their because we do get into that spiral of well, you shouldn't be able to buy soda and you shouldn't be able to buy chips. Okay, so you know what I thought about with this? We have to get better with the arguments that we use. So one of the things growing up that I absolutely love was root beer floats. I loved me a good root beer float, right? That's a part of my childhood. When I think about that, I immediately go back to that time of my life. So what we're basically telling people is if you need food assistance, you can't enjoy those small things like a root beer float with your family, right? And who makes that determinant? Because I feel like you shouldn't be able to. So we need a shifting of mindset too. I think that we're gonna take care of each other. We don't get come on. I want to brand that. That's gonna be we're gonna brand that and put that out for 2026. But it is that it's a perspective shift. If I'm going to take care of my fellow man, let me just let them do their thing, right? It's not our place. And if you're doing root beer floats, holla. Right. So you would change the access to food, you would change the housing security, and you would change the benefit that process. Yes. What's one piece of advice you would give folks going through this whole open enrollment? I know we just had a review of our benefits, and it was folks was ready to mutiny. Like, how much are my benefits?
I was on the insurance committee too.
It was like, you want us to pay how much? So I paid double for less coverage. That doesn't make any sense. So that was a whole thing. What's one piece of advice you would give, knowing what we're about to walk into through January 15th, about people trying to get benefits, trying to register on the marketplace?
Definitely consult with a certified application counselor or navigator before you select a plan. We only have 3 plan options in the marketplace this year.
Okay.
In previous years, we've had 7, 8 different companies. We have 3.
Okay.
So the pool is narrowing down. Every plan does not go to every hospital. So you have to be sure that the plan that you're picking is you're going to be able to use it with your current doctors or your current hospital systems. That's really the most important thing. And then on the Social Security side of the house, be patient. They are backed up, and because of the government shutdown, they are working with the skeleton crew. And even when it reopens, it's still going to be slow to come back, come back and to open up. But if you have a claim pending, you want to make sure that you're keeping up with it. They do give you the name of the person that's deciding your case.
Okay.
Most people just ignore it because it just comes.
What do we do with that information?
You want to call them and say, do you need anything from me? Can I send you medical records? When is the last time you got records from my doctor? Because that's what my team is doing. Where, because typically the way they do it is they will go into Ocean or Epic and just one time and pull everything that's in there. So if I decide your case in November, but I last pulled in August, I don't see any of this information. All of that is lost. So it's kind of on you to make sure that they're getting updated records. It's on you to know what your medical record is saying. A lot of people apply, but they've never even seen their medical record.
Can they just request access to that? Can they just go into my chart? Can they see what the information is in there?
Well, I believe you have to request those records. You can't just open it up in my chart and see. You can see, like a visit summary, but you won't actually be able to see that note. And those notes are really important as it pertains to your case, because they may say you have alcohol dependence, or there is nothing wrong. You don't know what it says until you actually read it.
So you get in there, read it. So take the ownership. Take it into your own hands. Be your own advocate. So that's one thing I share often. Be your own advocate. Keep your notes. And they can keep a binder and they can come and see you and just keep that all in one place.
Absolutely.
Right?
So as a side, they look at things. I call it the 3Ds. They want to know what your diagnosis is.
Okay.
They want to know the duration. How long has that been going? And is this documented? Is it documented?
The 3Ds. We might have to put that up on the website too. Any last information you can share besides just being super knowledgeable? Y'all see, she flexing. I like it. And I support it. Anything else people need to know besides not being afraid? Get your documents in order. Come see you. And if they don't have any documents, still come and see you.
Come and see us. We'll figure it out.
Okay. 414-727-6320 is the number to get connected to benefits. Y'all, we gonna make it through. Stay positive. I will say our next show will be, I believe, a rebroadcast on Thanksgiving. So if I don't see y'all, happy Thanksgiving. I will be available to taste test any mac and cheese. I'm off the wagon now until at least December 1st, right? So I'm a eat and have all the things. So invite your girl. Only if you can cook. Let me be real clear. Only if you can cook. Don't call me for that box mac and cheese. Don't you do it. It looks like we do have a caller, but I know that we're out of time for this morning. So we'll take it. Okay. All right. Good morning. Welcome to Community Heartbeat. I'll have you turn your radio down for me, pretty, please.
Yes, ma'am. I got you right. I'm sorry. I'm coming in late because I'm on a computer. But anyway, listen. I'm listening to what he's talking about with the health kit. The question is this right here. Now this is the marketplace. Is that set up around the Affordable Care Act?
Say it for me one more time.
I said, is this the marketplace for your insurance? Is that set up around you? That's set up around the Affordable Care Act.
Yes, sir.
Okay. Now this is the thing, and I want you to follow me real closely, because in the beginning of this whole thing, it was that we could hold on to our own doctors, and it was even said, I remember, that we would even have the same coverage as Congress. We would have the Cadillac plan.
Now give me the 10 seconds. You got 10 seconds to finish your question.
Okay, but what has happened to all of that idea that we were sold on and we're getting nothing? Like you said, to pay more now and then get less is not a good deal. So what has happened to it? Why has it just fallen apart like this?
Unfortunately, it's our current administration. Like I was saying.
No, forget the current administration. Even during the Biden years, even during when this thing was first set up, we're not worried about what the administration, they trying to erase dude's name off everything. But we're talking about what's going on with us, the people.
I think it might be, just the plan that you picked. Like I explained, all of
the plan that I picked. But you remember, we were sold the idea that we would be able to keep our own insurance. We'd have a Cadillac plan like Congress. Yeah. All of that was just a bunch of huff. I'm starting to think that that dude, so they use him to sell us a bill of bad goods, man. All righty, I gotta go.
Okay. Appreciate that question. Appreciate that question.
I would say go and speak with a certified application counselor or navigator. Because I work with folks that are happy with the plans that they picked because we went through it line by line. Like, what medications are you picking? We put that into the system. So it's going to tell you if it's covering that medication, if it covers that doctor, et cetera, et cetera. So please just, call us, call one of the other FQHCs, make an appointment to see a certified application counselor or navigator.
I love that. Love that. And I get the sentiment of what you're saying. It seems like we got a bait and switch. So I will say, pay attention to legislation. Pay attention to what people are saying. We are now at the part of our government, of our advocacy for ourselves, that you got to go read people's plans. You can listen to what they say on the radio and the talking points and all that, but go and look at what they're actually advocating for. Never forget that we have lobbies in this country. There are people that their job is to go and do what XYZ corporation asked them to do. So just in this moment, stay engaged. Don't tap out, stay focused, but listen and vote. Vote. I'm not going to tell you how to vote, but pay attention to what people are saying. Believe them when they tell you, and vote. I think a lot of people thought that this whole Project 2025 was a joke. And that's what we got. Do we have time to take this last? Okay. Because listen, Keith don't play games, y'all. He got to get in here. Brandy, thank you so much. You came through with the knowledge, sis. I hope y'all had y'all notebooks out. You can connect with Brandy, 414-727-6320. Thank you so very much for sharing. Happy holidays.
Make sure you say Brandy from Benefits. We have
Brandy from Benefits. Yes, please do. Please do. Y'all be like the cute way.
Don't do that.
This is Community Heartbeat, presented by Outreach Community Health Centers. Not just a show. This is a movement dedicated to bringing our community together through wellness, keeping your heart pumped with positivity. I'm Ebony Ssali. We'll see you next time.